So your building can really speak to the clients and tell them how it's performing. It can use sensors and IoT to let you know if some of your assets require maintenance based on their condition. And the way this all happens is through the integration of people and sensors and systems. And the system that we're talking about is IBM TRIXi, which is what we specialise in. Melbourne Health, the solution supports 10,000 staff, so clinicians, facilities management people, and in fact all of the staff can raise service requests and interact with the system. While they're not geographically dispersed, they've still got 33 sites and 70 odd buildings, and in the past doing that on half a dozen disparate siloed systems and paper-based systems. So coming to TRIXi has totally transformed the way they manage all of their facilities. Pretty stunning number of service requests. I think there's about 400,000 in the last 8 months that they've raised, so they're certainly utilising the system and continuing to grow and expand it through other areas of the business. One of the neatest bits that they've done is using a spatial, a CAD-based interface to the system. So when they need to know the location of a ward or of an asset, they can do that by clicking on the CAD drawing. There are already examples of them using AI and IoT, but we're going to increase the use of that sort of technology through the hospital. We implemented this on budget, and interestingly, we actually delivered it before schedule. We were confronted with COVID-19 just as we were supposed to implement, and it was decided by the steering group that we should implement early because they really needed the benefits coming from TRIXi during the peak of the pandemic. Enabling people to understand how many cleans they do, how many discharges they do, how many patient transports. They didn't have this data at their fingertips before, and now they have this information. They can be better resourced and better funded in the work that they do.